And we're here with Dr. Levine to answer your medical questions in our Ask the Doc segment. So happiness plays a big role in how you feel.
It kind of makes sense. You know, sometimes these things do not need to be studied. It's just common sense. I mean, I think people who are happier tend to engage in healthier habits, and because they are able to enjoy their life because they're not unhealthy,
right,
and they're not coming to see me all the time, they're not taking a bunch of medicines and going to the hospital all the time, yes, they can be happy and feel like their life is fulfilled, and they can continue to accomplish some of the things that they want to do every single day. So it's a byproduct actually of a healthy lifestyle. We talk about it a lot here on the show, so that's why we express it so strongly here on the show. Try to be healthy as much as possible so that you can be happy as you get older.
All right, on to some of our viewers' medical questions.
Right.
This viewer wants to know, in my walking cast, I go back to the doctor on February 13th. What can I expect and when can I return to work? This person is ready.
Yeah, I'm not quite sure. Just kind of depends on a lot of factors, what type of surgery, how bad it was, how long they've been out of the surgery. That's probably something they'll discuss at the visit. Just not enough information to really know, but just work with your doctor intimately. Don't push it because you might go backwards and then you'll be out even longer. So follow the directions of your physician.
Okay. This person is 13 weeks pregnant. They've been having a constant headache for about 4 days now. They don't know why. They've taken Tylenol and it doesn't seem to be helping.
Well, certainly get to your obstetrician. I mean, pregnancy brings on so many hormonal, physiological changes with your body. Anytime you have a new symptom, you want to make sure it's not anything life-threatening. I don't hear any red flags in that patient's story, but headache can be the symptom of something serious. So you don't ever want it to blow it away, especially if it's not responding to Tylenol, which normally works for most headaches. So I would probably get in to see their obstetrician very rapidly.
Okay. What would be a good over-the-counter treatment for baby eczema? She's 13 months old and has mild breakouts.
You know, I'm not quite sure. Don't do a lot of pediatrics. Normally in the adult world, we start with some anti-inflammatory creams and lotions that are prescription. Maybe an over-the-counter hydrocortisone cream might be helpful.
Okay. Is there a free dental clinic? This person is in pain.
I don't quite know. Probably there's a dental society that they can call and get that question answered. Some dentists, like some physicians, do have policies where they accept cash, so it just kind of depends, but certainly there's probably someone around.
Okay, this person stays hungry all the time. They found out they were diabetic last month. Is this normal? I
think anytime you have a change in your appetite, thirsty, urinating a lot, can't seem to satisfy your appetite, that can be some of the symptoms of diabetes. Certainly this patient probably needs to be on some medication and follow up with a physician so that these symptoms can go away.
Okay. This person is 49. They still get the symptoms of a period and she only has her ovaries. How do I know when my periods have stopped?
Basically, they stop, you know.
It's over.
It's over. You don't have them anymore. That's it.
Okay. This person has a bump on the back of their head by their neck. It's been there for about 6 months and it's soft, but it causes them bad headaches.
Well, anytime there's a lump or a bump that we don't know, we can sometimes biopsy that or have that surgically removed. So certainly if it's causing pain, you know, don't let that go. A lot of times they're just benign tumors like lipomas that can be removed surgically. But again, you just don't want something like that to go without an appropriate diagnosis and evaluation because it could be something serious.
All right, and just received this. Ubi Caritas has a free dental clinic.
Very good.
So there you go. You can call Ubi Caritas.
Yes, ma'am.
All right, and we've got lots of other questions. We'll get to those in just a minute.
Okay.
So don't go away. Dr. Levine will answer more of your questions next on Live at 5. Dr. Levine is back to answer more of your questions in our Ask the Doc segment. This viewer wants to know what's causing my constant migraines. This person gets at least 5 migraines a week, bless their heart.
Yeah, you know, that's a lot of migraines. We don't actually know the root cause of migraines. They're really working on it and they're getting pretty close to figuring out why. I think the big thing is triggers, trying to figure out what causes your particular migraine. You might have to take a migraine diary to figure that out. And another good thing is that there's good medications on the market that work very well tolerated. Certainly get to your doc because 5 a week is just too many.
Yeah, and those diaries are a big help, and a lot of medications out there and not one particular medicine works for everybody across
Just
the
like
board.
with anything else, doctors have a lot of choices. Our medication prescription is expanding all the time. It's sometimes very hard to keep up, but you're exactly right. That is part of the visit to your physician to try and figure out which one works for you, at what dose, at what frequency. You might have to change, stop, add, etc. That's what we do for a living. A lot of times you might even look at your phone and maybe get an app that you can download that might help you keep up with some of these potential triggers or give you some suggestions about what it might be.
All right, another question. A 63-year-old woman, her sciatic nerve damage she had 10 years ago and now has pain in the back of her knees that keeps her from standing for long periods of time. Could her knee pain be related?
Absolutely. You know, it's called referred pain. The origin of the pain is in the lower back or the lower buttock area, so it can refer to the knee. Sometimes it is confusing. We do a knee evaluation when really it's the sciatic causing that. Epidural injections work really well. Medicines such as Lyrica and Neurontin also work. Sometimes you need surgery. Weight loss helps, as well as tobacco cessation.
Okay, a 60-year-old woman wants to know, how do you treat the shingles?
The big thing is prevention, and certainly we have promoted the immunization. You can get that at most local pharmacies. The other big thing is getting it properly diagnosed. A lot of people get that pain and then the rash comes several days later. They don't get into their doctor's office. So if you can get in as soon as possible and get on therapy, then you're more likely to be successful at treating it and not have pain afterwards. So three medicines on the market work very well for that, especially if you can get it as soon as possible.
Okay. 42-year-old woman has diabetes and wonders how to get insulin without insurance and without Social Security.
Yeah, I'm not quite sure. Again, maybe Caritas has some help for her. There are clinics here and around the area that help with patients who don't have insurance. Obamacare, Affordable Care Act, look into some state exchanges that might be very helpful. I think there might be an insulin that's over the counter. I'm not quite sure about that, but the medicines, tablets, are so inexpensive on the generic plan that you can get medicines for $4. So you should be able to get on something that is affordable.
Okay, a 20-year-old man. Can a young woman get pregnant if she is sexually active while menstruating?
As far as I know, no. That goes against the physiology of pregnancy, but weirder things have been known to happen. So,
so be careful.
Be careful, yes.
A 58-year-old woman is diabetic and having trouble with balance and is having pain from her hip to her feet on her right leg. What could be the problem?
Several different things. Diabetics get a lot of neurological issues. That is the problem with diabetes. It affects the circulation, which then affects the neurological system. So balance can be one of those. A lot of times they're on blood pressure medicines, diuretics, cholesterol medicines, so a whole host of things. Don't let it last. Certainly get a proper evaluation, brain scan, ultrasound of your neck. That can be a serious symptom.
All right, Dr. Levine, as always, we appreciate your
Yes,
time.
ma'am.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com or post those questions every Monday on our KFDM News Facebook page.